Hello, and I'm here to introduce Whole Washington and the Healthcare as a Human Right Washington Coalition. And a little bit about me. I am not just the social media lead at Whole Washington, I do a ton of other things. And I'm the Healthcare as a Human Right Washington Policy Co-Chair. So a little bit about Whole Washington. We're both a 501c3 and C4 political nonprofit. We're the authors of the Washington Health Trust, which is the only universal healthcare bill in the legislature. We're the largest universal healthcare group in the Washington with about 300 active volunteers. And we are the only universal healthcare group actively building a ballot initiative campaign. And we are part of two coalitions, Ballot's Our Tax Code, which recently passed the millionaire tax, and Healthcare as a Human Right Washington. Healthcare as a Human Right Washington is a grassroots community labor organization with 40 member organizations and 20 allied organizations, and we're hoping that we get a 41st right here, and that's in the works. So what's the problem with our healthcare system? You all know, that's why you're here. It's too expensive, we pay way too much, and look at that rise in premiums, it's disgusting. We pay more than anywhere else in the world, and it wasn't always that way. And despite that, we don't live as long as any other developed country in the world. And we spend way more on administration. This is waste. This is waste, fraud, and abuse. This is what the government says they're getting rid of. They're not. We still have it. And we aren't actually benefiting from the private insurance model. So if you look at wait times, people bring up Canada all the time. Do you notice an outlier on this chart when it comes to that yellow bar? Canada has the worst wait times in the world. Other countries with universal healthcare have similar wait times to the United States. And that's without pricing out 30% of their population from having access to specialist care. We also have way higher both maternal mortality and infant mortality than any other country in the world, and that's because we leave communities out. We also basically invented and hold the world record every year on medical bankruptcy. I can tell you these numbers for the other countries. They're not quite zero, but they might as well be. They're like 10 or 15 or 20, and we're hundreds of thousands. And when we look at the state of Washington, it's pretty obvious which area of the state is going to get hardest hit by the federal changes. District 4, CD4, where y'all are, that this is the hardest hit area in the state. And we see this with hospital closures, with a majority of the both current and projected hospital closures occurring in this area. Rural Americans are also the most likely of any rural demographic in developed countries to struggle with medical bills, tracking the normal population pretty closely. Life expectancy versus income in the United States is disgustingly disparate, with a 15-year gap for men and a 10-year gap for women between the poorest and the most well-off Americans. And the solution to this is universal health care. It really is. So a little bit about what universal health care is. Universal health coverage means that all people have access to the full range of quality health services they need when and where they need them without financial hardship. These elements were 0 for 5. Universal healthcare works around the world. We're the outlier. Mexico is the newest member of the club that is universal healthcare. Those of you following the news know this. And that puts us embarrassingly behind almost every one of our comparable nations or our neighbors. The desire for change is bipartisan. It is not just a left-wing issue. Right-wing people, Republicans, think that our elected officials need to do something about this. What we don't agree on exactly is the method. And Americans are really not as divided as most people think on universal health care. We're at about 2/3, 1/3. This is almost exactly the same ratio as the millionaire tax, which Tim Eyman recently told Brian Haywood, please don't run an initiative against this because you're going to get trounced. So that brings us to what we do. We have a universal health care financing bill. This would create a universal healthcare system, not quite single payer without government help, Medicare being federal and Indian Health Services and Veteran Health Services, create some complications there. But if we do get waivers for those programs, we could become a single payer system. Doctors and hospitals would remain private practices. Countries with similar systems to this are Canada, Taiwan, and South Korea. And one of the reasons, like the glimmers of hope we have, is that back in the 60s, Saskatchewan adopted universal healthcare, and within 10 years, every province in Canada had adopted universal healthcare. This can happen fast. What would this provide? Comprehensive coverage of medical, dental, vision, hearing, mental health, and reproductive care. And there would be no deductibles, no copays, no networks, no denials, no bills, and zero out-of-pocket spending. We consider this a very, very, very big deal. Networks, half the conversation today was about networks. So what are we doing about this in the legislature? We are introducing several bills. We have our flagship bill at the top, the Washington Health Trust. We also have looked into removing private insurance companies from Medicaid and having the state take over that financial responsibility, expanding the Medicaid cap. We have a Universal Health Care Commission. That one's a little technical, but making it sure they actually do something. The single payer trigger bill, this bill made it all the way through the Senate this year before the House killed it, but this would have, if the federal government gave us waivers, allowed us to institute universal health care right away. And lastly, a healthcare amendment. Our neighbors to the south in Oregon passed a healthcare defending amendment into their constitution, just like the education one. And it has already held up to judicial challenge, actually very recently, which is pretty exciting. You want to learn more? Unfortunately, I don't have any more time, but you can visit wholewashington.org. You can follow us on social media where you'll see way too much of my face, or you can email me at thomas@wholewashington.org. I am happy to talk to any of you.